Hi, Dave from Align Therapy here. I'm here with Emerson, who is going to demonstrate a little bit about why we have headaches after scoliosis fusion, or even just with scoliosis in general. So we're going to talk about a couple of things you can do, but mainly I want to talk about how we know where the headaches are coming from. So Emerson had scoliosis surgery, and that fused that area of the spine that was curving too much. So she's fused down to L2, she's fused up to T3. So we don't have movement in those segments. I'm impressed that you knew that. That's awesome. So that area of the spine isn't going to move. So what happens, and what happened with Emerson after she came out of surgery, and when I saw her after surgery, was her head was sitting more forward, because we don't have the mobility in that part of the lower part of the spine. So the upper part of the spine kind of goes forward because we're kind of used to that forward position. So I want you to show me forward. It wasn't quite like that, but we weren't too far away. So that is part of the reason that we start to get headaches after scoliosis surgery, is because the weight of the head, our head is basically just a bowling ball sitting on top of the spine. Yours is smaller than mine. And that being forward puts more tension on the muscles in the neck, and so the neck muscles start to tighten up. And as the neck muscles start to tighten up, they pinch on nerves up at the top of the spine just below the skull, and they can create headaches that go up and over the head. That's a classic tension type headache after a scoliosis fusion because of that posture that happens. Sometimes the shoulders go forward too to get into that forward position because the spine isn't moving again. So a couple of tests that you can do to see if that's where it's coming from, because there are other types of headaches. There are migraines, there are cluster headaches, there are other headaches that might come on kind of coincidentally with a scoliosis fusion, or you may have had them before. But a classic headache with this is one that starts kind of in the back and moves forward, or it starts in the front kind of above the eyebrows and it might work its way back. Some of these are on one side, some of these are on both sides, but a couple of tests you can do. So if you, actually Emerson, turn and face this way. So a couple of things you can do. You can push on the muscles here on top of the shoulder. This is the upper trapezius and the levator muscle. If those are sore, Emerson, are those sore at all?
Yeah.
Yeah, those are sore, she says. So that tightness and that soreness, it doesn't mean that these headaches are coming from there, but there's some tension in those muscles. Then as we work up into the neck, really the spot that I'm going to push on is right at the base of the skull. So you just meet my pressure here, Emerson. How's that there? It's fine. So a lot of times I'll hold pressure at the base of the spine. So my fingers are like this, and I'm holding pressure right at the base of the spine, right over those muscles that are right under the skull. Base of the spine, I meant base of the skull, top of the spine. And we're holding pressure there to see if that reproduces the symptoms up and over the head. So I'll hold pressure there. Sometimes I'll hold for like a minute. I'm not going to do it on Emerson. I don't want to give her a headache right now. But you can hold pressure there to see if it reproduces those symptoms. One thing you can also do, sometimes these muscles down here, if you hold pressure on the knots, those trigger points that are in the neck, sometimes you can feel that headache increase as well. So either of those things are helpful to see if that's where it's coming from. You can also look at neck range of motion. So tip your head forward, Emerson. How's that feel?
Like it's stretching.
Like it's tight? Tip your head back as far as you can go. Good.
That's not very far.
That's not very far. Go ahead and go back up. And tip your ear to your shoulder. So that's a little limited. We should be coming a little closer than that. Go to the other side. Okay. Now just turn and look over one shoulder, and then look over the other. So a limitation in range of motion can also indicate that we have more like tension type headaches. So look at those things if there's limited range of motion, tension when you push on those muscles, and if we can reproduce the symptoms of pushing on those muscles, then it's probably a tension type headache. And that can really be helpful to know so that you can treat it correctly. We stretch for those manual therapy, massaging out things, deep tissue work can help with that. Dry needling can be really helpful, and working on correcting posture, bringing that head back and strengthening your shoulder blades is really important. That's for a different video though. And hopefully if you're having headaches after scoliosis correction surgery, that you can figure out what's causing them. When you figure that out, it's fairly easy to treat, but it does take some work and it does take some time for your body to adjust for that. So hopefully this was helpful for those that have headaches that have had surgery. If you want to learn more about scoliosis, feel free to check out our website. And thanks, Emerson, for being a great model. And thanks for watching.